I'm going to run you through the equipment required for unblocking a male cat. So to start with, we'll need to prepare the animal. The site will be clipped and aseptically prepared. You can use chlorhex and metho or iodine and metho if you like. Next, we'll need to set some stuff up for our vet. Hand towel, gloves. Some may use a fenestrated drape. Others might just use the paper from their gloves. And also some surgical hand scrub, which is located near our sink. We'll then need some appropriate size urinary catheters. These are Slippery Sam Tomcat urinary catheters. They come in a range of widths and lengths, so sometimes it might be good just to get a couple of different sizes out. Sometimes it might be difficult to get the urinary catheter in straight away, so some vets might choose to use some IV cannulas to help. And we'll also be needing some sterile lube. Once the urinary catheter is placed and unblocked, we will then get a sample of the urine, so it's good to have a urine pot collection available. And we'll also be needing to flush out the bladder. So some vets like to do that themselves, so I'll keep some sterile kidney dish on hand and syringe, and they can do that themselves, or sometimes they might ask you to do it for them. Next, we will be wanting to secure the catheter in place. And we will need some rat's tooth forceps, some needle holders. These ones have the scissors on them as well, so I don't need extra scissors. And some suture materials, just some nylon will do the trick. And then we've also got a little Herbert adapter to pop on the end of that urinary catheter so we can collect our collection bag. For the collection bag, we need an empty fluid bag. This one is 100 ml. You could use a 500 ml, you could use a 1 litre. It's just important to remember if we're very busy and we are not up on time with our TPRs and getting back to our patients, this 100 ml urinary bag might not be enough, so we might want to be using a bigger bag. But this just connects to the giving set, and then the giving set will connect to the little Herbert. Alternatively, depending on where the cat is being hospitalized, maybe we might need some extra length to our line, so you can also attach an extension set as well. So I just attached this here together for you to show you. We will also want to be making we want to be attaching our line close to the patient to their tail as well, and we want to be doing that in a slip loop way, sort of like this, and we're taping this part here to their tail so that if we get any pulling or any pulling this way, there's some room for it to move before it completely pulls on the urinary catheter itself. You can secure that to the cat's tail with some tape or with some vet wrap. If you are using tape though, I do suggest that you clip a ring bark its tail as well. We'll also need to pop an e-collar, and a soft one is nice for comfort so that they don't get to their urinary catheter. The other thing that we want to be doing is popping our urinary collection bag into an empty kitty litter tray with an incontinence pad. This keeps it nice and safe away from people kicking or standing on the bag. It's cleaner so that things don't travel up the line. Also, we can see if there is any leakage either in our bag or our connection or our line, because we'll notice that on our incontinence pad. I'm going to show you where you can get all the equipment now. So our hand scrub is located here near our wash sink. I have made up a kit. It includes everything except you will need to get appropriate size gloves for the vet. Also a kidney dish and some flush as well. When we need to make this kit back up though, our urinary catheters, our slippery seams are located here down the bottom. The little Herbert adapters are here at the top. We do normally, when we have some available, have the empty fluid bags sitting here for the collection. Our giving sets are here. Hand towels, rat's tooth forceps, needle holders, we've got single packets of sterile KY jelly. Obviously our syringes are here. Various glove sizes. Fenestrated drapes in the middle shelf. Down below, kidney dishes. Also hand towels. Also sodium chloride for irrigation. And some suture material. And the last thing probably is a urine pot. Which are here. Also, if the vet wants to make up some slides and have a look, slides are kept here. Kitty litter trays. Incontinence pads.